Like every nation, the United States has faced some of the darkest moments in its history. There was a time when deadly pandemics swept across the country, claiming the lives of more than 1 million Americans and changing the nation forever. Yet, even in the face of unimaginable loss, the American people stood strong. Communities came together, medical workers fought tirelessly, and the country pushed forward, emerging stronger and more resilient than ever. Today, we're counting down the 5 deadliest pandemics in American history, where the death toll ranged from over 100,000 to more than 1 million lives lost. The facts, the numbers, and the stories behind these historic tragedies may surprise you. Number 5. Hong Kong Flu, 1968 to 1969. Long before COVID-19, another influenza virus spread across America with astonishing speed. The Hong Kong flu, caused by the H3N2 influenza virus, first appeared in Asia in 1968 before reaching the United States through international travel. Although modern medicine had improved significantly compared to earlier decades, the virus still infected millions of Americans. An estimated 100,000 people died in the United States alone, making it one of the deadliest flu pandemics in American history. Worldwide, experts estimate between 1 and 4 million people lost their lives. Unlike many earlier pandemics, vaccines were developed relatively quickly, helping reduce the overall impact. Even today, descendants of the H3N2 virus continue to circulate as part of seasonal flu. Number 4. Asian flu, 1957 to 1958. Just 11 years earlier, another influenza virus had swept across America. The Asian flu pandemic began in China before rapidly spreading around the globe. The virus reached US cities within months, infecting schools, military bases, and workplaces. Roughly 116,000 Americans died during the outbreak. What made this pandemic historically important wasn't just the death toll, it was America's response. Scientists identified the virus quickly and developed one of the first large-scale influenza vaccination campaigns. That rapid scientific response became a model for future outbreaks. Number 3. The 1918 Spanish flu. As the First World War was coming to an end, an invisible enemy proved even more deadly than the battlefield. The 1918 influenza pandemic spread with incredible speed through military camps, trains, ships, and crowded cities. Unlike most flu viruses, this one often killed healthy young adults between the ages of 20 and 40. Within about 2 years, approximately 675,000 Americans had died. Worldwide estimates range from 50 to 100 million deaths, making it one of the deadliest pandemics in human history. Doctors had no antibiotics for secondary infections, no antiviral medications, and no vaccines. Communities closed schools, theaters, churches, and businesses in an attempt to slow the spread. Public health measures that would be echoed more than a century later. Number 2. HIV/AIDS epidemic. In 1981, doctors in the United States began noticing a mysterious illness attacking healthy young adults. No one knew what caused it. Within a few years, scientists identified the human immunodeficiency virus, HIV. Unlike influenza, HIV spreads through specific routes including blood and sexual contact, and without treatment, it can lead to AIDS. Over the past 4 decades, more than 700,000 Americans have died from HIV-related illnesses. The epidemic also transformed medical research. Today, modern antiretroviral therapy allows many people living with HIV to lead long, healthy lives. But there is still no cure. The HIV/AIDS epidemic remains one of the most significant public health challenges in American history. Number 1. COVID-19 pandemic. In late 2019, reports of a new coronavirus began emerging overseas. Within months, it had reached every corner of the United States. What followed became the largest public health emergency most Americans had ever experienced. Hospitals filled beyond capacity, entire cities shut down, millions worked from home, schools moved online, families celebrated holidays through computer screens. More than 1.2 million Americans have died from COVID-19, making it the deadliest pandemic in US history by total recorded deaths. Scientists developed multiple vaccines in less than a year, one of the fastest vaccine development efforts ever achieved. The pandemic permanently changed healthcare, remote work, education, travel, and the American economy. Its effects continue to shape everyday life. Pandemics don't just change medicine, they change history. They reshape governments, transform scientific research, influence economies, and alter the lives of generations. From the Spanish flu of 1918 to COVID-19, every pandemic has left lessons that continue to guide doctors, scientists, and public health experts today. If you found this countdown informative, don't forget to like the video, subscribe for more fascinating American history and documentary content, and let us know in the comments, which pandemic do you think changed America the most?